from the hormone discussion. And I do think that's actually a big, before we get into it, a big reason behind women waiting so long is that it feels like this scary thing that for some people they don't want to kind of like have to start because they don't really know what it entails. And, with hormones, there is what we call a window of opportunity. And we were taught, back in the day that you only needed them in the absolute worst case scenarios. And now we know with all the research, you don't have to wait until you haven't had a period for a year. That bringing hormones in earlier can actually provide massive amounts of benefit, and it's actually safer. So when we talk about hormones and we say hormones and bringing in hormones, when we talk about women, we're talking mostly about estrogen and progesterone. Yes, there's testosterone, but these are the main ones. And we talk about hormone replacement. It really mostly is talking about estrogen, replacing estrogen. And I always like to talk about why we would even consider that. And menopause is the transition, the brain ovarian connection changing, right? Because our ovaries, as we age, they become less responsive, right? And that is natural. We have a finite amount of eggs or follicles, and so those decline with age. And so the responsiveness of them to the brain chemicals also declines. So as your ovaries are responding less and you're having less follicles become stimulated, your brain must send more and more signal to kind of get ovulation to occur. And so what can happen is you can have these big, massive pockets of estrogen that go really high and low. And so eventually when the signal kind of stops and ovulation isn't happening, a woman's not producing estrogen in higher levels anymore. And that not only has impacts in the transition on mood and sleep and body temperature, but also on bones, cardiovascular health, brain health, like a lot of the really critical systems that we want to make sure are protected with the use of estrogen. And so when you hear the word bioidentical, that buzzword, it means it's the same type of estrogen that's in your body. So if we gave it to you, we could test it in the blood and see those levels increase. We could see your estradiol. So we're talking about estradiol. And there's a lot of commercially available hormones now. Most people are prescribing estradiol, like bioidentical estrogen. It's quite rare to see people prescribing non-bioidentical anymore. Birth control is synthetic estrogen. So when we talk about estrogen, there's patches, there's gels, there's creams. So there's mostly topical forms. There are also oral estrogens. The topical forms, they bypass the liver, so they have a way better safety profile. So oftentimes we want women on a topical form of estrogen, and you must protect the uterine lining. So if you're going to give a woman estrogen, you must also give her progesterone as well. And progesterone itself has a lot of benefits. And again, the more with more research coming out, the best form is the micronized. So it's an oral ovule of progesterone, and that's often taken in the evening before bed, and it's really beneficial for sleep, anxiety, heart palpitations, and it can be helpful for hot flashes as well.
So almost always it sounds like, Emma, you're going to take both. You're going to take estrogen and progesterone.
Yeah, and when you initiate those is different. Progesterone is often the one you would initiate and start with. Often in perimenopause, it's that estrogen to progesterone gap that creates a lot of problems with sleep, mood regulation, and initiating progesterone at that point can really provide a lot of symptom benefit, specifically for sleep, nighttime anxiety, the like waking up at 2, 3 in the morning, kind of feeling that pressure on the chest, a lot of that physical anxiety. Progesterone can be incredible for that while your body is kind of working its way through the estrogen ups and downs. Once you start to transition into late perimenopause and your period, you start skipping periods, that's when you can bring in a little bit of estrogen. That's how we practice, gentle, slow, low, listening to the woman, making sure, they are actually getting benefit. So you do want to go you do want to make sure you're tailoring it and listening to each